Good evening, friends. Welcome to the Tuesday evening critical care and other departmental intensive care updates. We have been doing this for almost for the last 1.5 years or so, with the different diverse topics which were debates in the world, which were of concern to all of us. But over a time, we realized we wanted to just do something different from a regular webinar. So today we thought of bringing something new. This thought process came to me when our nurse educator, our nurse Kirti, met our team a few months back after her recovery and spent almost 1 hour of time explaining her all experience during all of the 2 months period in our ICU. So how was he feeling when she was on a prone position? How was he feeling when somebody was doing a tracheal suctioning? How was he feeling when somebody was doing a tracheostomy with sedation and relaxant? And what were those all kind of her experiences? She was been a nurse. She was been a nurse educator. She cared hundreds of patients during her nursing training and during her nursing education. But when it came to her, when she was a patient, she could see the difference of what being a patient and what being a nurse on the other side. So we have a real reversal that where she is now taken a role of a patient. So she is sharing with us all those experiences in our academic room. So I felt these kind of other components of health, as we understand the definition of health includes not just our medical part of it, but also social, psychosocial, and mental, and many components of it. So during our treatment or in the flow of our treatment, our priorities will be focused more on medical component of it. But we sometimes are not able to take care of all the segments or dimension of health. Those includes emotional care, psychosocial support, and other components when we actually come across these patients and the family members. To understand it more, today we actually brought Sister Kirti on board. So she will be she will be explaining how she has gone through those periods of her ventilation and her intensive care stay. Our interventional pulmonologist and the seasoned clinician during this COVID time, our emerged budding pulmonologist, Dr. Sai Reddy, was his primary consultant who actually saw her in the emergency room when she came to our hospital and took passionate care of her for the 2 months and followed her for another 2-3 months to make her back to normal life. So we wanted to bring him back to actually see how he was actually coping up all these healthcare professional related challenges when some healthcare professional gets involved into this disease. To start with, we will take Dr. Naresh, who will actually brush us through this case. And from there, we will take the discussion to Sister Kirti and then our expert pulmonologist to Dr. Sai Reddy. So Dr. Naresh is our consultant intensivist and critical care specialist in Yashoda Hospitals, Secunderabad. Over to you, Dr. Naresh.
A very good evening, Venkat sir, Sai Reddy sir, senior members of the faculty, colleagues, and dear friends. Today we'll be having a brief case discussion, followed by an experience sharing session with Mrs. Kirti, who is our own hospital staff. She has been a nursing educator and continues to be our nursing educator. She was admitted with severe COVID pneumonitis. She was actively involved in the nursing education and training of the staff when preparations for COVID patient care were ongoing.
Sorry to interrupt, sir. Please close the PPT and reopen it again.
You can open the slide. So
Or is one moment, sir. I'll share the screen. Dr. Naresh, I'll share the PPT.
Yes.
So continue.
A very good evening to Venkat sir, Sai Reddy sir, senior members of the faculty, and colleagues and dear friends. Today we'll be having a case brief and an experience sharing session with Mrs. Kirti. She is her own hospital staff and she's been a nursing educated here. She was admitted for severe COVID pneumonitis. She was treated and discharged from here. She has been actively involved in the nursing education and training the staff when preparations for COVID patient care were being going on.
Naresh, you are muted.
Dr. Naresh, please unmute yourself.
Dr. Naresh, can you hear us?
So there seems to be a software issue that is being addressed, sir.
Okay, Naresh, can I read the case?
Yes, sir.
So I will just take you through the case. Can we go to the previous slide? Okay, next. The previous one.
Is this okay, sir?
Yeah, fine. Naresh, can you get this? Yeah, go ahead.
I need control of the slide.
Please continue like this one, sir. No worries. Dr. Naresh.
Continue. Sorry, I don't have.
Yeah, continue like this, sir. No worries. We can.
I don't have access to changing slides.
What? I'll share the presentation. You just let me know the slides. Next slide.
Next.
Okay, next slide, please.
Just one moment.
Yeah,
Dr. Naresh, please start.
This clinical brief is not much about the clinical situation of the patient. It is rather to have a better understanding of the physical and the mental state of the condition of the patients when they are in such a situation. We should think of it in the background of having invasive procedures like tracheal suctioning and vascular cannulation, and also change in positioning like proning and all. Along with that, the awareness of the events during the hospital stay of the patient is also an issue that will be considered in this topic. Next slide. So we have a 26-year-old nursing educator, Mrs. Kirti. She was admitted for COVID pneumonitis, and at her admission, her room air saturation was 75%, which includes around 90% with oxygen. A CT severity score, a CT was done during that time, and the CT severity score was 18/25. Patient was ICU admitted, and later on started on oxygen. Gradually, she went on to the NIV. Next slide. As was a norm, she received the standard dose of steroids, remdesivir, mechanical ventilation, and supportive care. This was her admission. The left CT was her admission CT, which showed a CT severity score of around 18/25. The next CT was one which was prior to intubation, which showed a CT score of 20/25. Later on, she needed to be intubated, and later on, she landed up on the sedation and paralysis. Her FiO2 requirement and PEEP requirement were considerably high, and we were having trouble maintaining her saturations above 90%. At this point of time, she needed multiple prone sessions, and between her prone sessions, we could get a CT scan, and we had seen that the CT severity score has worsened to 25/25 with a fairly visible neomediastinum, which was present at that point of time. At this point of time, she continued to have proning sessions, and this was a CT which we had got when she was in proning session. Here we can see that extensively the lungs are involved, and only a apical area on the left side was spared. The rest of all the lungs were involved, and we could see a faint hint of neomediastinum anteriorly. She was continued on mechanical ventilation and received a number of prone sessions. Later on, after she was tolerating on supine sessions, we tracheostomized her for prolonged weaning. However, there was a prolonged ICU stay, and she spent close to 40 days on the ventilator, and overall the ICU length of stay was around 8 weeks. This was her family who constantly supported her during her stay in the ICU. They would constantly come and encourage her and keep her in a positive element to give her the support and the necessary psychological backup. They did a great job at doing that, and you can see her smiling and having a confident smile. She recovered to have minimal oxygen support and intermittent BiPAP. At this point of time, she was discharged to the rehabilitation. At rehab, she continued her recovery. Initially, she had a requirement of oxygen, but gradually her oxygen requirement had come down. At this point of time, we were constantly following her up, and later on, we called her back to the hospital and planned for a tracheostomy decannulation. Next slide. Next slide. Post tracheostomy decannulation, she continued to be in the hospital for a day, and then she required minimum amount of oxygen. At this point of time, when we were confident enough that she'll maintain herself outside the hospital, we shifted her back to the rehab and we followed her there. Her recovery followed in rehab. She was able to do her regular day-to-day activities, and she was having an unrestricted lifestyle later on. When we compare a CT from the worst point of time to the latest CT after discharge, we can see that the CT at which she was prone, there were extensive lung changes and hardly any lung tissue which was left. But after 4 weeks, the same CT, we repeated a CT scan, and that showed recovery and faint hints of fibrosis. But otherwise, she was maintaining well on room air. We can see the amount of fibrosis which had on the apical areas, but middle lobes and the lower areas were reasonably recovering. Next slide. Now she is back to work, encouraging and educating a fresh set of healthcare workers, and she is now, next slide. This is her team. Her friends and family have been close support to her. Her team members and the team of doctors were always in touch with her and constantly following her up. Next slide. Next slide. Today she'll be sharing with us her experiences during her treatment and enlightening us about the psychosocial and the emotional issues being faced during such experiences. Next slide.
Thank you, Naresh, in bringing that case story of Kirti. See, this is not a regular case discussion. I think all of us during the last 2 years has seen this set of sick patients in our ICU. And we know many hundreds to thousand patients has gone back home happily. Yes, we were unfortunate in many occasions where we lost few. But the reason why we brought this case here and why we brought Kirti here for discussion is it's not related to the clinical management because we know there are hundreds of webinars across the world which is looking after this clinical management side of it. But we thought to bring some emotional, psychosocial aspects which we wanted to bring from Kirti. So Kirti, welcome you here. Nice to
Good
see you
evening,
back,
sir.
Kirti.
Good evening, sir.
So what a pleasant moment for all of us and a proud moment that our only healthcare worker who got such a sick disease as a team from Department of Pulmonology, Dr. Sai Reddy leading from the front, intensive care medicine, your healthcare supporters, all brought you back to your smile and brought you back to your education. And what a nice platform to start, Kirti. You are an educator, you are a nurse, and you are here for educating all of us related to the concerns which which are beyond treatment. So we only focus on treatment, but we wanted to learn from you beyond treatment. So to start with, Kirti, what was those emotional moments going through your mind when you initially turned to be positive? So nowadays, positive word has been a havoc. So when you tested positive, what was your initial response and how badly you got affected?
So, good evening, everyone. Myself, Kirti, nurse and a nurse educator. I'm here to share my experience and gratitude. So, when I heard about that I'm COVID positive, definitely it will be a panic situation for me. When I heard about I was COVID positive, then I was emotionally broken down. I tried to call my parents and my husband. They were supporting me that everything will be okay. Emotional support were given from them. I have to thank everybody because without you all, I would not be here.
Yeah, to know that, yeah, you have been initially broken and you had emotional breakout and you called your family members at home. So
Yes, sir.
when you actually then needed a probably hospitalization and you are brought to the emergency room,
Yes, sir.
you know, ki many of the times most of us must have been counseled you to stay home, get isolated, you take just supportive care, you will be all right. But that didn't help happen to you. You had further worsening, so you have to come to the hospital. We will not go into the clinical component of it, but when you came to the hospital, you are in a sick state. You had
Yes, sir.
giddiness, you had desaturation, and you being a nurse, you know ki you are deteriorating, your condition is worsening. So you
Yes.
came to the emergency room. So what was going through your mind when you came to your emergency room?
As a nurse and as a nurse educator, I have seen people suffering, like patients suffering. They used to call to us, they used to tell many things. Like, I want to talk to my family, please can you call them? But when coming to my experience, it was very difficult. When I joined in the year, I was in unconscious state. I have came here. Then everybody, my colleagues and my family, even doctors, nurses, total healthcare team members were supporting me. They were telling that, okay, once we give the plasma therapy, everything will be okay. You will be recovered very soon. So that positive impact of them made me be here.
Okay, so once you actually came to the ER, you must be worried. See, it is very easy to talk to people. It is very easy to give lectures. It is very easy to maybe write an article that you should be confident, you should be very positive. But when it comes to you, when it happens to one of your family member, bearing that in mind, carrying yourself in that state is not an easy challenge. We know what must have been gone through. As you're expressing, there were many, you're lucky that you had many friends and well-wishers in and around who are doing. You're saying that may not be true for many families because when it is a COVID positive patient, they may have one attended family who may not be also around. So they may be going through the same agony. So the next component is when you needed an intensive care unit after your CT scan and oxygen requirement assessment. Once Dr. Sai Reddy saw you, so there are probably you have been shifted to ICU. I just wanted to know from Dr. Sai Reddy that he has been called as with a consultant on call to actually visit you, to help you, to look after you. So once he reached, what was his reaction when he saw? See, whatever I believe, Dr. Sai, she was the first girl after the initial first wave who actually at her age got affected to that sickness in our healthcare system, in our healthcare workers. If I look at all of them, so most of them were on milder, but she was the most sickest among all. So you have to attend. So what was your initial impression? What was your initial feeling when you saw her?
Good evening, everyone. Because when I saw it first at emergency room, our oxygen was around 56. Initially, I felt nervous because we're treating the same patient for the past 1 year. Definitely, one of my junior colleague nurse admitted the same severe sick disease. I felt nervous initially, looking at case scenario and our oxygenation levels, our age, youngest patient. At that time, she's the youngest patient in our entire Yashoda issues. So initially I felt nervous, but slowly I can boost up myself. She's a patient, you have to treat completely. Then I went to Kriti and I talked to her clearly what was happening. So I told her nothing will happen. Slowly we'll improve day by day. You have to cope up with the treatment. So as a team, ultimately we did it, sir. Initially it's okay, but we did it completely.
So when it comes to one of our family member, when it comes to one of our colleagues, the things will not be the same and easy, Dr. Sai, as you rightly pointed out. When we see one of our member who was treating team for us suddenly turns to the other side and he came in a sick state. So Kirti, not easy, but again, you have been transferred from the emergency room to the intensive care unit because of your need of oxygen and your sicker state. And I do understand, being a healthcare professional, you understand what it means by shifting to an intensive care unit. So we may be talking to many of the families and patients in a different way. But when you've been transferred to an intensive care unit, you are the patient there. You have seen that intensive care unit 100 times before. But when you went on a bed, wheeling down to that ICU, what was your take there? How do you actually feel?
Actually, first, when I heard that people were after plasma therapy, I shifted from ER to RICU, sir. So there, doctors were telling that you will be RICU means ICU. Okay, we can understand it is a critical care. Yeah, so I felt little bit panic, nervous. Number of questions were going through in my mind. I was stuck at. So what will happen to me? Because when we saw patients coming to us, when we are treating the patients, it will be other scenario. But when as a patient, I come as a patient, so it will be again a different scenario. So I thought it was emotionally, I was literally broken down. So I was asking everybody, what is happening to me? How could I get over this? Positive thoughts I'm filling up with in my mind, but it happened.
So that's the actually message which we, I think, wanted all of us to share. These are the expressions which Kirti was giving throughout her recovery phase. So I want all the team, the nursing team, the pulmonology team, the critical care team, all the healthcare workers, we may be doing phenomenally great work on the treatment aspect and the treatment part. But when a patient says, I wanted to meet my family, sometimes they say, I'm feeling very nervous. Where am I going? What is happening to me? So sometimes we may, with the load, with the workforce, we may sometimes get dejected, saying, you just stay calm. Why are you getting worried? Why are you anxious? But when it comes to you, then you realize how important these all aspects, soothing them, giving a word of probably comfort, putting a hand on their head or something like that, how important and how soothing it is. So once you are there in the ICU, once you are there in the ICU, I know you realized you are not in the stable state. You had some concerns, so that's why probably the medical team decided to keep you in the ICU. Other side, Dr. Sai, we do understand when one of your professional, either a doctor, either a nurse, gets admitted under you and you are taking through that. So what was going through your mind? How do you actually dealt with dealing the case of Kirti? What was your challenges when you actually dealt a healthcare professional being your patient?
Different scenario, sir. Treating the patients and treating healthcare workers is a different scenario, because usually as Kirti as a nurse, she know the disease prognosis, she know everything. Definitely she had half knowledge about the COVID and what is a ventilator and what is ICU. And so we sat down daily with her. So when I go for rounds with her, I used to sit down for at least for 5 to 10 minutes. Because I used to own the patient for just to 10 minutes. I used to listen to her problems because she had a lot of thoughts in her brain. So I'll try to alleviate all the thing one by one, because she listens something, she's seen something, she'll go into more anxiety. So I sit beside her and told her clearly, nothing going to happen. We're taking day by day. You're improving slowly. We made it.
With all this assurance, Kirti, you didn't improve. If I'm honest on that, you went on worsening. Okay, day by day, your oxygen requirement went off. You didn't tolerate HFNC. We went to switched off to NIV, but that was a very transient time. You deteriorated very rapidly on NIV too. So then we needed a kind of a discussion to tube you. And you being a nurse, you know what intubation means. And that too, the scary time, which with a lot of what I partially said, knowledge that once you get intubated, the chances of your recovery will be challenging. But these things has been communicated to you and you have been put into your tube. So what was actually going through your mind when being a nurse, these were discussed to you and in front of you with all of us talking about it and all that? How was your feeling at that time?
Being a nurse, health professional, I know few medical terms like doctors were discussing in front of me, like ECMO, lung transplantation, ventilation, intubations. So when I saw the patients intubating, ventilated, everything, it was nothing will affect us. Like we are nurses. When we treat the patient, we become a nurse. It will not affect us much. But when we become the patient, it will be like different state of mind, sir. We'll go through many panic. We'll have panic. Anxiety levels will be more. So if we get anxiety again, all the vital parameters will be again abnormal. It will show. So when I heard about these all the terms, I was like, what is happening to me? Why these situations? Why I'm going through this kind of situations? So it was running in my mind.
So but all these negative component of things of progressive worsening happening to you, unfortunately, and in spite of all our best, you are worsening. So how? See, it is very easy to counsel, convince, all of us were doing, but to make up your mind, what was going through your mind to keep yourself positive? Which thoughts of yours, which perspective of yours was keeping you positive during this whole stay?
Like I can tell, I was listening. I feel like I want to talk to people like around me, whoever is there, like nurses will be there, doctors will be there, everybody will be there. I used to divert my mind by talking to the people. When one person come and talk to me, I used to feel very happy, because being on the bed for being on weeks on the bed, it is a difficult part for us.
Yeah, Kirti, I was asking which success stories were keeping in your mind was actually making you feel that no, I have a chance.
Once as a nurse, I have seen most of the peoples will getting cured. Yes, so I do had that trust in the doctors and the healthcare team members that one day I will be fine. I will be back to my work. I can do everything. So that positive thought made me to be here.
So probably that's what actually I think the whole world is talking about. A very small fraction of patients may need hospitalization. A small fraction of patients may need ventilation. Even in that ventilated patients, Kirti and many of our nurses and many of us seen success stories. So being a nurse, probably she was also going through that. She has seen patients coming out. She has seen patients walking out. So that probably kept her positive in spite of she knows there were eventualities. There were unfortunate patients whom they lost, but she kept on thinking about this positiveness. Kirti, it is very interesting to know your comments when we spoke to you about prone ventilation and keeping you sedated, keeping you paralyzed. I know when paralysis means that you can't move. So
Yes.
when the sedation may be fluctuating in and around in spite of we being monitoring you. So what are those points which you remember when you are on prone or supine or on paralysis? So we wanted to learn from you so that all our nursing team, all our medical fraternity, including intensive care, whoever are listening to this webinar should learn how a patient who is on a ventilator on a different proning position with all his muscles being paralyzed, so he can't move. So what was your feeling at that time?
Most of the times I don't remember. I was unable, sir. But when I had
That means Dr. Sai and Dr. Naresh's team was doing wonderful job in sedating you. But
Yes.
I think there must be team moments which you remember. I still believe that there are moments you may be remembering.
Yes, sir. So most of the times I did not remember, but what the things I do remember is during proning, sir. So I had a drizzling of secretions. So I felt like due to that secretion, I felt a little bit itchy was there. So I want to call the people. I was trying to move my hands a lot, but due to the sedation, I was unable to move my hands and legs. And other things, what I remembered is during supine position, I remember that people were calling me, Kirti, are you okay? How are you? Then I used to respond to, I want to respond them, but due to sedation, I can't even open my mouth because these things happen. And even when proning, I do remember that people, doctors, nurses, everybody used to give me physiotherapy, which made me more comfort and getting out from the disease. Then I do remember physiotherapy. This mostly this.
So we know there was many good things happened. You're being a nurse. You're one of our pleasant patient there. So we want to save you and do everything. But we
Yes.
also wanted to learn the tender points. I am still confident that you must be having some pain points, some tender points during your stay from where we wanted to learn. What are those moments which felt like it is terrible, it is intolerable in intensive care unit, whoever may be in intensive care? These are the procedure which should be handled very sensitively. What are those tender procedures which you felt should be known to all of us?
Tracheostomy suctioning, sir. It was the most difficult part. In one word, I can tell that it's like a hitting of hell. It's hitting like me, hurting me like a hell, sir. So it was suctioning was very difficult part for me, which I went through that. Then I had even cannula, sir. Multiple prickings were done for me because invisible veins are not visible for me. So day by day, they used to change my cannulas, multiple pricks I had even. So these things were pricking me a lot, but I did it.
Any other points like in the rounds, you must be seeing many of your doctors, colleagues, nurses, friends must be visiting and discussing among themselves. How many of them you remember? See, many of us may be discussing many things in the rounds.
Yes.
Maybe sometimes deliberately, sometimes unnoticingly, we will be discussing about the patient condition. How many of these discussions really hurted you, or how many of these discussions made you a little nervous or a little kind of you getting into anxious moments?
Being on the bed, when I was there on the bed, I heard people talking about different patients, like Dr. Sai Reddy sir, you, everybody, different sirs, like Hari Prasad sir, everybody, you come to me and used to talk to me. When I heard about, again, other patients, other patients were deteriorating, it used to worry me a lot. Then I used to think about this situations are going worsening day by day with all the patient. So I'm also in that same position. So what will happen to me? I was thinking that, and my colleagues, family, And even the nurses, everybody, they came to me. The daily one or other person used to visit me. They used to talk to me. Whenever they used to come and talk to me, I felt very happy because that positive thoughts of them made me, sir. Because being on the bed, we will go in depression. Number of questions will be running in our mind. Why this happened to me? What is the reason for happening this? So it will be a depressive state, panic state, anxiety levels will be more. These are all the things will be there. But you have to come out with a positive. If you have that positive attitude of coming out, everything will be okay and you will be alive.
Yeah, so Dr. Sai, I just wanted to learn from you. In the last 2 years, you have been in the frontier of pulmonology department along with other pulmonologists in handling and treating patient. One side of the whole story was treatment of the COVID illness with supportive and multiple combinations or permutations of medication. The other side was family and convincing counseling and soothing patients' anxiety, apprehensions, and panicness. So how important you thought during the last 2 years, caring, not just the treatment, other aspects played an important role in the COVID?
So with any disease where there are a lot of psychosocial factors, with the COVID, it is the more psychosocial factor will play in a role. As Kirti said, once any patient diagnosed with the COVID patient and patient will get to panic actually. And to add on this, a lot of running around society, that will create some more anxiety. So when any patient is diagnosed with COVID, just sit with the patient and discuss with them clearly what's the nature of disease course, what's the nature of illness, what's the treatment plan. Just try to own the patient at that time. So definitely will give a good results, because it will increase their confidence, it will increase their moral. Ultimately, it will give very good impact on their health.
So how you could manage? We know during the peak time, you used to have hundreds of patients under your belt, either your primary cases or a referral cases. So how could you actually manage to talk to these patients and their families? Did you made a conscious effort to divide your time between treatment and also spending time in conveying this message to the family and the patients?
Like a different case to case, because in some, like, we used to finish the rounds and then talk, what is attendant. In some cases like Kirti, I used to call her father. I used to discuss in front of her father, how is she now? She's improving day by day. I used to say all positive aspects of her case every time. If I want to discuss any disease nature completely, I used to discuss separately with her father. So we have separate time for the counseling, but usually we try to counseling the same time. The bedside counseling, it's helped me because saving time, not only saving the time, and there are a lot more positive impact on the patients and patient attendants actually. By seeing the patient attendants, in Kirti seeing by her husband, seeing by her father, she had a lot of positiveness in that thing.
So with this high transmissibility infectivity in the first wave with the government regulations, many of our hospitals didn't allow any family members to come in physically. So we tried to do our best by doing a video calls and trying to show their loved ones through a electronic media or video calls. But later on in the second half, once the vaccination is over and we try to allow the family members with PPEs on or masks on, so they used to come down to the bedside to look at their loved ones. So what do you think the second wave or later on post second wave also we continued that trend? What made the difference? As Kirti said, the kind of see the family members and the patients both wanted to see each other, both wanted to discuss, talk to each other, know at least express their problems to each other. So how you thought this could have been made a difference during our second wave recovery?
Because as we learn lesson from wave one, when wave one used to completely isolate, the strict isolation, we never allowed any attendance. We have video calls, but the change in pattern, like after vaccination in wave two, it gave like a lot of positive impact in patients, allowing them providing a psychological support, providing emotional support. So definitely it increase their morale, increase their confidence. So it will increase their confidence to fight against infection.
And also families. I remember many families used to complain that our patient went to a hospital walk-in, and we know many of their patients accept their lung as a single organ, the other neurologically or other systems were absolutely intact. but they get deteriorated, and once these patients get into a very sick state, and they lose their loved ones, so they say they came walking. But during this second wave onwards, when the family members walked in, they could actually saw the patients and the deterioration and the efforts of the medical professionals and how they are spending inside. So probably that gave a lot of I
Yes.
think confidence to the family that the medical team is doing their best. We are in the best hands, and we from our side should pray and leave the all possible outcomes to the in the hands of God. So I felt that kind of change came into the families. What do you think? The acceptance was better. The I think the mindset of the other families and relatives was much better in second wave when they came in and saw the patients.
Yes, sir, as you said, it's a much better, sir. In wave 2, they're much better. And it eases our job also, sir. In not like a wave 1, wave 2, there's more is our job. They're coming daily, they're seeing the patient, they're interacting simultaneously with me and with the patient. The ease of our job, and patients also like, because they're also so happy by seeing their loved ones, like father, mother, parents, right? It most impact in their health status, sir, actually. But it is the same way it's over the medical, along with our routine medical management, because we follow standard protocol for every patient. And this is add-on treatment, sir.
Okay, Dr. Naresh, what is your comment? Can Dr. Naresh be on board? Unmute yourself. Dr. Naresh?
Sir, I'm having a few connection issues here.
So, okay, you can be on board. Naresh, Kirti spoke about difficulty in tolerating a tracheal suctioning. Okay, Kirti also spoke about how difficult it is to tolerate repeated cannulations or a repeated peripheral line attempts. So many of the times central lines also being not easy or needed a ultrasound guidance and arterial puncture or arterial line cannulations, all this. So what is your take? So how sensitive we all are, or how sensitive all our medical staff and nurses, and what should we learn from this Kirti's episodes?
Sir, I feel there are 2 points, 2 sides of the coin here. One thing is that at any cost, I would want to have a good IV access where I'm not going to be in a situation where I'm going to be troubled because of IV access is not proper. At the same time, I want also monitoring to be there, a patient on ventilator and getting prone. So the focus of the doctors and the treating staff like myself will be in accessing those and getting them at all cost. And what happens is most of the time we don't look at a patient like a patient as a fellow human being, and we treat it as this is our goal, this is our target, we have to reach it no matter what.
True.
This is what happens, and most of the time when we put the sheets on, I think the human element in us just vanishes, and
our priorities change. Our priorities is oxygenate her. Our priorities is to get a map of 65. Our priorities is prone her to improve her oxygenation. So sometimes we get lost, or we get diverted into. So true Naresh, in that sense, it's absolutely true. Kirti, coming back to you. So how important it was when you are actually recovering from your ventilation. I still remember the moment I tried to come to you and say, please give a trial of spontaneous breathing trial. Within no time, you will get tachypneic, tachycardic, you will be anxious, you will be sweating, you will be doing everything. So in that time, many of us try to convince you, counsel you to at least give some efforts of repeated attempts of spontaneous breathing trials. And I still remember we have to give a lot of anxiolytics, we have to give a lot of sedatives, we have to give a lot of pain relief, including opioids like morphine to you to calm down and tolerate the ventilator and give us help. So in that time, what was the role of your fellow colleagues? I can still remember many of your friends like educators and your nursing colleagues were walking down to you to cheer up you, to motivate you, to make efforts to bring you back. So what was those moments mean to you?
Actually, when I worked as a nurse, so I do remember that nurses will is calling us angels. So I felt like angels were all the time beside me, taking care of me, sir. So when you people were coming and telling me to sit So I was little bit nervous. I used to think in my mind that why sir is ultimately telling me to sit. Sometimes I used to act like I was like not in a conscious because I felt that is what in my mind, sir, because I don't want to do it. If I do it, I'll think that something will happen to me. Because of that panic and anxiety levels, I used to behave like that. But ultimately, your people goal is to get me back. So this is what I can tell, sir. But you people are always there for me to support me, sir.
How was your family made a difference? I could see a father, a husband standing strong with you during this COVID time, wearing a mask. How important your family bonding and they coming to you, hugging you, they making you better.
Yes, sir, it was an emotional bond. As I said previously, no, sir, nurses, when I worked as a nurse, patients will telling to us like, you call my father, husband, and even because we want to share our feelings.
Yes.
When we see them, that feeling is entirely different. So that will make us that, okay, these people are there for us. We can get rid of any kind of hurtful situations.
So families always make a bigger difference in
Yes,
spite
sir.
of all of you. So you felt the family, like your husband, your
Friends.
mother, your father, whoever are around, friends are around, they made a bigger difference to you in
Yes,
this.
sir.
Dr. Sai, I just wanted to know when Kirti told me that she used to listen all our internal discussion in your rounds, in our rounds. So we unconsciously or consciously make a lot of discussions in and around the bedside. To our intentions will be to make our patients better, but I doubt sometimes we may also speak about all the possible complexities in that case. So that carries to many of our patients, like our healthcare professional. Some of our intelligent patients do understand many of our medical terms. So what is your take on that? When Kirti told me all that, when she was on prone or supine, she remembers many of our discussion. I was little taken away. So we do many discussions, and we believe the patient is sedated, knocked off, but subconsciously they may listen many of our discussion. Sometimes that may be disturbing to them. Sometimes that may be causing a lot of anxiousness to them. So what is your take on that?
Like a way, because like a very good like a bedside one includes so try to like, your ability to connect with the patient and use your skill to connect their emotions. Actually, the thing is when you're around the patient, when you're in and around the patient, so try to talk only the past 2 weeks and the positive thoughts and the positive about the case. Actually, if they're completely sedated and paralyzed, as you said, usually we'll discuss about case in detail regarding ventilation, cardiac arrest, and everything we'll discuss. When they're alert, when they're in a mild sedation, so try to don't talk about negative things. Even they put even beside the patient, try to discuss in a separate place. So it will definitely decrease their anxiety. Actually, if you want to discuss anything positive thing, discuss in front of the patient. Definitely, that boost up their confidence. If you want to discuss anything negative things, so discuss separately. Even the same patient, if it's an opposite patient. Very
I learned very many of them when I was actually was appearing exam in one of the Western countries. Whether a patient is sedated, was paralyzed, or on a ventilator, before you do anything on the patient, you have to go to the patient and discuss and tell about that. I'm going to cannulate you here. It may hurt you a little. I'm giving a local anesthetic. That may hurt you a little. I'm catheterizing your urinary tract. So it may hurt you a little. I'm pricking you once for IV cannulation. So I think that kind of cultural change which we need, and all of us has to practice. Like even though the patient is sedated, paralyzed, is under the, we don't know, they may be subconsciously still having some of those lower lighter planes which they may be realizing. And as you said, we have to be very sensitive when we are taking rounds and we are talking about a patient, and we take the patient as one of us there, not like a ignorant the patient lying down there with a sedation and paralysis. Probably those are the things which will make. Dr. Naresh, any points from you? We do have rounds and we do discuss things.
Sir, I remember when she was there in the ICU quite well. At one point of time when the intubation was needed, it was night time, and I was focused on keeping her fine, keeping her alive and keeping her fine. So I discussed with her. I told her that we'll thrombolize you. We are going to intubate you. Don't worry. You have to be stable. You have to be fine. And after that times, during her multiple sessions of proning, we were there with her. And later on, when she was supine and the tracheostomy was done, and when she was awake, she remembered me and she smiled.
So
That point of time, I knew that she made it out. That
okay.
was a very humane touch to what was going all around when we were concentrating on very core critical care and core clinical issues. A slight smile from a fellow patient who recovered, and she being a healthcare worker was a very personal push for me as well.
So, Sai Reddy sir, the other component is when a medical professional gets into ICU bed, I think most of the times we think about the worst possible things to happen to us. This we term in many medical ways. Whenever we get any of the disease, we think about many complexities linked to it. So being a nurse, being a doctor, whenever we get COVID, we don't think a milder form of COVID. We always think those sick ARDS patient who actually needed a multiple proning, needed an ECMO, or many difficult things goes through our mind. So it is very difficult to be a patient also, and also a doctor to those patients also. What is your take on that?
It's a very difficult scenario, sir, because though we're treating hundreds of patients for the years together, but once we are the patient, once my colleague is a patient, it's a very difficult scenario because they know all the pros and cons of the disease, they know the complications, they know all the procedure things, and very difficult to convince them also because always in the mind they'll think about the worst thing, they'll think about ventilation, they'll think about the bad prognosis only. So sit with them, share our previous experience, because though you're a patient now, you are a part of the team initially. We saved number of patients. So remember all those things. You're the simplest, this is the infection. So we'll get out of these things at any point in time.
Okay, and Dr. Naresh, we are speaking about this proning and muscle relaxant, partial relaxants, partial sedation, because we all now understand keeping deeply sedated, deeply paralyzed may make our patients critically illness, polyneuromyopathy, weakness, and all. So that also leads us or drags us to a controversy that the patients may be conscious in those states, and they may be also are aware of the surrounding. This may cause a post-traumatic stress disorder or a depression, psychosocial issues in the post-recovery phase. So what is your take on that?
Sir, the number of critical illness, neuropathy, and the muscular weakness we had seen during that phase during the second time, one we have to understand is that so many cases at any point of time prior to COVID, we had hardly 1 or 2 ARDS cases a week. But this was a point of time when we had 20 beds and almost 15 patients were in ARDS. And we were doing procedures which we were doing once a month, like thrombolysis and all the week on a daily basis. And proning sessions were carrying on. At one point of time, I remember that we started proning at 9 in the morning and we completed proning for all the patients at 5 in the morning, 5 in the evening. So at that point of time, we knew that some patients would land up in complications, but anything we had certain targets and we had to reach them. We had to maintain their oxygenation of the patient. We had to check their ventilator parameters frequently. I remember checking lateral pressures for each and every patient, going around, discussing with our colleagues, discussing with the nursing staff. It was a very probably once in a lifetime experience of handling such thing, and hopefully it's the last experience we have.
We don't come across again and again of the same.
Hopefully that's the last experience we have in our lifetime.
So Kirti, I'm not seeing many queries, but many compliments to you that you're back, and they are very happy and quite enthusiastic of you being back to work, and we hope you will enrich many of nursing teams teaching them. So the final comments from you are related to you, how your team members, your intensive care, your organization, your medical admin were to you during this all period. I know you have gone through most difficult phase of your life in the last 6 months. How this were with you?
Yes, sir. So first of all, I had a good family who supported me in all ups and downs. Then I want to tell about, I had a good team support, sir. So my team were very spiritual team I had, who used to pray for me all the time. who used to visit me, one or other person. So if they are busy with their works, we used to get a call from them, like, how is Kirti, how is doing her situation. So these are all the things made me, sir. Then I had everybody support, sir. Not even single person. I total Yashoda. They heard that Kirti, one of the educator, is admitted in the hospital. Not even the nurses, doctors, staff, security, housekeeping staff, everybody used to come to me, and they used to tell that you will be fine, we will be praying for you, you will be fine, you will be back. These are all the positive things made me here, sir.
So how psychosocially, financially, and other ways the whole admin and the management came to your rescue, and how were they?
Instead of calling it as an organization, I do tell it as a family, sir, because they Yashoda family, so they supported my family and me financially, sir. So they I heard
So
that
I know it's not an easy task to be
yes, sir.
sustaining for such a long period.
Yes, sir. Yes,
if
sir.
you ask me, some of us, including Sai, will also agree with me. Some of us cannot afford it. Some of us
Yes, sir.
cannot even sustain it. Such a
Yes.
long period of time with so many complexities, so many supporting things, gone through a turbulence of phase. So you have been, we are happy that the whole team and organization or whole family came to you for this good cause. And we are glad that you are here along with all of us, sharing these moments. We will cherish these moments for our life. And with this, actually, the program, our all intention was when Kirti came to us and expressing her all views regarding or during her all this period of 2 months, we thought of sharing those moments with all of you. See, the webinars, the attendees who are attending this webinar, either they are a nurse or they are a doctors or they are any healthcare professionals. See, many of us has to find ourselves as a patient and see from a patient angle how they are feeling. So this is what I can actually summarize from a Kirti's point of view. Whenever they ask for a family, whenever they ask for a hurting, whenever they ask for some comfort, whenever they ask for some difficulty, we ourselves placing their position. And if you think, I think we can deliver much better care. I do understand the last 2 years were too exhaustive. Many of us has gone through a turbulent, not just psychosocially, but health related challenges also. But we are fortunate to be alive, and we all got those team support from each other. We patting each other's back, and we are all still alive and being with full energy and force to bring back many more lives alive. If we have any future waves of similar kind, we wish that we will not face any similar kind of maybe sicker patients with this current wave. But God forbid, if similar situation comes, as a team, as a group, we all will be standing with each other to make our all safe. So with this, actually, I thank Kirti in accepting our invitation and coming here and expressing what an extraordinary phenomenon of listening to you, Kirti. You are a real core educator. We can see your voice in spite of being tracheostomized, having a scar on your throat. Your voice was phenomenal. You are really a nurse educator. We hope you will educate many more nurses in coming days. And Dr. Sai Reddy, sir, I have seen you caring Kirti. What a passionate care you have been giving to her. And not just to Kirti, I remember you walking down to me and many other team members like Dr. Kamlesh, who is being an internal medicine part. All of us, you being making a effort to actually give a combined support to Kirti. And that was phenomenal. And not Dr. Naresh. We know intensive care is a team efforts, like Sai had his own team. We had Dr. Hari Prasad, Dr. Abhishek, Dr. Nitin, Dr. Karthik, many registrars, many nursing team, many housekeeping team, many respiratory therapists. Many people will be behind saving many lives. I think we congratulate and appreciate each one of their efforts. And I conclude this session by thanking all of you, thanking all the audience and participants. Thank you. I
Thank you,
conclude
sir.
the session.
Thank you, sir.
Thank you.
Thank you, Naresh.